Alrighty, good morning, Pagosa. A big thanks to RG Bank for bringing us the news on this beautiful Friday morning. And Feliz Viernes. Happy Friday, everyone. Glad you've joined us on the radio. We're actually at the hospital today, Pagosa Springs Medical Center, for our show. And on our show, it's Crystal DeCola and Jason Webb.
Good morning,
Crystal,
Will.
Jason, good morning.
How are you?
Good. How are you?
Doing good, man. It's
Excellent.
a good day.
Yeah, it is. And thanks for inviting me to the hospital.
Sure. A little different than the normal radio booth, but you got a nice setup here.
It's very nice. I love the sound of this gadget that I'm using. It's just
a little smaller than your other
good quality sound. So you guys are getting the A-team, I guess, equipment-wise. I don't know about me, but
or me.
No, you guys are A-team for sure. So what are we going to talk about today? It looks like trauma.
Yeah. I wanted to talk a little bit about our trauma system here locally that we've developed. Give a little background and kind of what its purpose is and how it works. It's a really important resource that we have really in the region, as a lot of hospitals do not have trauma designation or trauma capabilities. That being said, almost any hospital you can walk in with an injury and receive some sort of treatment. But there's what we call designation, which is kind of an approval process through the state of Colorado and the broader trauma systems that if you meet a certain criteria, you can get what's called a trauma designation. And in 2016, we went through our first process to become trauma designation. And that really means that you've got not just an ER, but a lot of the supportive resources that can help take care of a trauma patient if somebody's injured.
Is it designated by the state or the federal folks? Or?
Good question.
Yes.
Yeah, it's by the state of Colorado. Okay. They have the state health department has a trauma and EMS wing, and they have lots of rules for our EMS providers, but then they also have lots of rules for designation. And there's 4 levels of trauma designation in our state. A level 1 is like usually your big kind of university-based systems, big healthcare systems. Most of them are on the Front Range, where they have a lot of resources, and they're able to take just about any type of injury that may happen, and they're able to take those injuries and treat them from the initial ER all the way through rehabbing maybe an injury. But as you go down, there's a 3, a 2, or excuse me, the other way, a 1, a 2, a 3, and a 4. We're actually a level 4 trauma designation. Which means we have the basic capabilities to take care of a trauma patient very effectively. What we don't have is the broader surgery capabilities like neurosurgery or some of the more advanced plastic surgeries or some injuries that we're unable to take care of because we don't have an intensive care unit here. But we are a level 4, and we gained that in 2016, and we're super proud of it.
Yeah, let's face it, we have trauma here, right?
We have lots of trauma, and on that note, we looked at some data from last year in 2024. In this level 4 designation that we have here at Pagosa Springs Medical Center, we saw 1,863 trauma patients in a year. So if you think about that, that's a lot of people that have been injured by various different mechanisms. We have the big outdoor climate here, and a lot of people like to do things outside, and we have a major highway that goes through town. So you add all that together and normal city fun, and that's a lot of trauma patients. Of those 1,863 patients, only 72 were bad enough that we had to send them out.
Oh, interesting.
Where we had to fly them to a higher trauma designation.
So that's a pretty low number, actually.
Very low. So what it means is we're able to keep a lot of patients here and treat people here. And Crystal leads the team in the ER with the nursing staff and the physicians and kind of that mix. And I lead the side on the EMS side, which is about getting you here, and then once they treat you, getting you out of here.
Quickly.
And so that's kind of my game. And so we work together a lot.
Yes. Crystal's the director of nursing. I meant to say that in the beginning.
Amongst
Jason,
lots of other things.
Chief and director of EMS. Yeah.
We wear lots of hats here.
Right. Including doing the radio show.
Thank you very much. The radio show. So I wanted to talk a little about when you come in as an injured person, a lot of people think about just the ER, and the ER is a very important resource in the equation, but it's only one piece of it. If we just depended on the ER without supportive services, patients wouldn't have the outcomes that they would have, and we couldn't be a trauma designation. Some of those resources that are really important include the lab and the blood bank. So that's really big in trauma. With trauma, and I'll talk about it in a little bit, we have the golden hour, but blood loss is a big deal. And so you have to have access to blood, and you have to have access to send blood samples to the lab so that they can measure various levels in your blood to see how much you actually have. And so that's a key resource, and we have that here 24/7 at the medical center, which allows us to, if somebody comes in and they're bleeding heavily, once we stop the bleeding, which is step number one, then you got to give blood back. And so that blood bank is huge. Radiology is another essential service that supports the trauma designation. Really big in x-rays, and in the game of trauma, CT is the main modality that we use a lot. The CAT scan, yeah. It's where we put you in this big tube and zip you in and out a few times, and they're able to take thousands of pictures at once. So detail, high def pictures. Yeah, and they even recreate them so that when you look at the image, you can actually see a layered system of your organs going up through your body. So it's really 3D almost. Very much 3D, and that's where they can identify broken bones, bleeding, all the various types of injuries and things that they find. Sometimes even medical problems that are in there are found on trauma scans. So that's a key one. Obviously, if you're bleeding, one of the primary resources that fix bleeding is general surgeons. And so, being a longtime EMS guy, we always say when we're running calls, where's the person that can fix this? And it's always in the OR, the general surgeon. And so our job is to get them there quick. So we have general surgery. We have our amazing orthopedic team. Sure. With any type of injury, you're going to have broken bones, and those need to be put back together. We have Dr. Steed and Dr. Webb who do an awesome job of putting people back together. And the rest of the surgery team, I definitely don't want to discount the supportive teams that work with them. EMS is a big component. We're part of getting people in and out. And then a lot of people ask me about flight teams. So highlight here in Pagosa, there is actually a private medical flight evac team that is stationed here in Pagosa. They're out at the airport. They're called Classic Air, so they have a fixed wing out there. And then the rotors, we have about 4 or 5 different organizations that we can call, usually within 30-minute window of response, where like one's in Durango, one's in Montrose, one's in Farmington. And so we can access those when we're out in the field to activate flight teams to get people to the level ones. So a lot of times when you're in a big trauma, you end up on a flight somewhere when you live in a rural place like this. Much different than the city where there's hospitals everywhere and you can drive them via ground. But here you really depend on those flight services. Wow, that's so important, and we're so lucky to have it. So yeah, very much so. So that initial kind of window when you're injured, it's those services that have to come together in a very organized fashion where communication's clear, objectives are clear, and what we're trying to do is get you what's called the golden hour. We're trying to solve that. The golden hour has been around for a long time. It comes from the military, actually, where the military studies trauma probably more than any other type of specialty, and a lot of what we learn in trauma comes from actually when there's warfare and there's conflicts that are happening. There's always a lot that they learn, and then that comes into the private world, and then we embrace it and put it into the civilian side of medicine. That golden hour, really what it means is after an injury, a significant injury, you have 1 hour to resuscitate the person. After 1 hour, the risk of mortality goes up dramatically. So the name of the game is speed, about trying to find where is somebody bleeding and then trying to get them resuscitated, stop the bleeding, and then return that blood volume back to them. And if you can do that within an hour, usually, depending on injuries, but usually they have a much better outcome. So if you think about it, from the time that an injury happens, the person has to call 911, activate the public safety resources. Then, we respond out there, we start our care, we transport, we activate the trauma team. The trauma team comes in, all the stuff that happens. We have 1 hour to do all of that from beginning of injury until we have them resuscitated. And without a really strong network, local network of all these primary resources that help support trauma, it would never happen. And how many miles of road do we have here? And I don't know. Dirt road. And a lot. I know our area is 1,800 square miles that we cover, and so not all of that is roads, but nonetheless, people have injuries all over the community, and we have to figure out how to move them around, how to get them to Crystal and her team to be able to continue the care and manage them. So it's quite the dance. Before I get too far into kind of the golden hour, I also want to call out, once you have your initial injury and you get the resuscitation done and you kind of have that initial injury window taken care of, it's not over. There's a lot of rehab that goes along with that. And there's a lot of other medical things that bubble up long-term in trauma. And so I want to make sure that I call out, there's 2 resources that we have at the medical center that are super invaluable to getting people back on their feet and getting them back to where they were before the injury, and that's your primary care team. So you wouldn't think about your primary care doctor being vital in trauma, but it really is, because once you impact different organs, different things come up that need to be managed. And there's a big mental health component of it as well. When you have injuries and your whole life has been changed, mental health can come up as part of that as well. So primary care is a big deal. And then we got to make those bones and those muscles and those joints stronger. So the physical therapy team is going to get on you and start having you move and exercise and start strengthening all those muscles and bones and all the things that were impacted by the injury. So all of that comes together in a very organized fashion to try to get a good outcome.
Integrated.
The only other thing I would add with trauma, especially trauma designation, the nursing level of care is important, and the specialty of the nurses as well. So everybody who works in the emergency department has specialized emergency nursing training. When you're trauma designated, they kick it up a notch, and our trauma nurses, our ED nurses also have a trauma nurse certification, and so they do. They already have taken their nursing boards. They already have their experience working as an ED nurse, and we go one above that. And now they have their trauma nurse certification, which just allows them greater critical thinking skills. They have more in-depth knowledge of the things that Jason's talking about out there. And so it is really important when you're thinking about, Jason's team brings them in, and now it's a swarm of nurses and physicians in the house who has what specialty and certification. So that was just one thing I wanted to call out, because I'm a nurse and all.
Yeah, how's that? Yeah, how does that work when there's kind of urgency and everything's kind of happening fast and you got to respond? And
just like that, Will.
Yeah.
It is the craziest thing you've ever seen. If you watched it from afar, you'd be like, that's chaos. But it's actually kind of working.
They know what they're doing. They have a plan when this happens.
There's usually a physician that's pretty loud and is talking about what the priority is, and there's a whole group of people, mostly Crystal's team, but these other supportive departments we talked about, and they're working through it step by step to make sure that they establish those priorities and get that golden hour of resuscitation completed. Mm-hmm. And so it's a lot of work, and those classes that are the certifications that Crystal's talking about, those are no easy course to get through. Trauma, just like anything in medicine, is its own specialty. And so those ER nurses not only have to be good at heart attacks and all the other specialties, but trauma is also a specialty that they have to know about and be efficient at doing. Once we hit the door, usually we try to give the team a heads up, but once we hit the door, it's an organized chaos is really what it is, right, to get those priorities done.
Hit the door, like the ER door.
The ER door, that's our phrase. And we come through it pretty quick. We don't actually literally hit it, but we're moving pretty quick with a purpose usually.
Imagine.
I wanted to reflect a little bit more on that golden hour, and so I was previously spoke about it as in terms of replacing blood volume and resuscitating somebody, and all the things that go into do that. But before we get too far into the golden hour, the best thing in the world is prevention. And so there is a belief in the trauma world that actually all injuries are preventable. All trauma is preventable in some way. Sure, accidents happen, and it probably will never always be that way. But if you really look at every time somebody got hurt, you can almost ask yourself, how could I have avoided that? And you can almost come up with a way to do it, right? So there's some things that we push a lot for prevention that I think are valuable to call out for people. The first one is making sure that seatbelts are worn in the car. I've been doing this for 25 years, and there's been an emphasis on seatbelts from the very beginning. Frequently, I go on car crashes where people are unrestrained, even children are unrestrained. Really, that restraint system, although it's not 100% going to keep you safe, for the most part, it keeps you very safe if you're involved in
the car too, right, or the truck or whatever. And
totally.
And I don't know how you avoid it with all the sounds in the car nowadays, but I guess there are ways to avoid a seatbelt. I don't know.
People do, and it happens frequently. I look at them the same way. Helmets when people are riding bikes, skateboards, or those type of events, skiing, any of those kind of events where you're at risk to hitting your head. A lot of people don't wear helmets, and head trauma is one of those things that is hard to fix. The head is one of the hardest things to repair when somebody's been injured. So it's better to avoid those things. So seatbelts, helmets are a big deal. If you have like itty bitty ones, it can be hard to understand what's the recommendation for car seats and those kind of things. I'll throw out that EMS will always, if you pull up to the EMS station, will always come out and help you with your car seat and make sure it's connected correctly and that it's protecting the child the way it's supposed to. As that little guy develops, so does his seatbelt needs, and they can change as well. So we're happy to do that at any time. It's a free service that we offer. You just pull up to the EMS station and we'll help you with that. So those are things that
Where's the EMS station?
Ooh, good question. We're at 189 North Pagosa. So if you know where the medical center is, if you jump over 160 to the north side of 160, where people know where the firehouse is, Station 1 is, the firehouse.
There, right?
We share the same campus as the fire department does. So there's a brown building on that campus that we house ourselves in. The fire guys as well. I know I don't want to speak for them, but I've seen them help a lot of citizens with car seats as well. But back to that golden hour, one item that I really wanted to hammer on, or two items, I guess. One, when an injury happens, the first thing, if there's major bleeding, you got to do is stop it. Blood does you no good if it's on the floor. It only does good when it's in your body, right? And so having the ability to stop bleeding is key to anybody surviving a traumatic incident. And it can be something fairly small, like a cut or simple chainsaw injury that's not gnarly, but just cuts the skin a little bit, and it can cause us some severe bleeding. And having the skill set to recognize that person's bleeding a lot, that's an arterial bleed, and knowing how to stop that can save somebody's life. We offer courses throughout the year at our training center. As I've called out before, it's called Stop the Bleed, and Stop the Bleed is put on the American College of Surgeons, and they believe that all trauma is preventable, but if it happens, having a skill set to stop bleeding is the key. So we really recommend anybody in the community that lives here take at least one class. It's only a couple hours long. It's a lot of fun, and you learn how to manage different types of injuries throughout that could happen, that you might run into maybe when you're out in the woods, or maybe when you're out fishing or doing something fun. Without that bleeding stopping, there's a lower chance of survivability. So we need everybody to try to learn how to be able to do that. And the other side of it is call an ambulance. Even if you feel like, I don't know if they're going to I don't want to be transported, I don't want to pay for the bill, any of those kind of things. We'll work with the person that's involved once we get there. But the key is getting that blood stopped. And so sometimes kind of the layman's way of stopping bleeding isn't effective. And we have a few more tools in our toolbox that come with the ambulance, plus people that have dealt with it a lot. And so calling us out there is the best thing you can do. If there's a big injury, the soonest you can get 911 called and get the response team coming to you, that clock is ticking, as we talked about with that golden hour. So you get us out there. If we get out there and you stop the bleeding and there's no other service to provide, then great. There's no bill. We just head out. We're happy that you're okay. But if it doesn't go the way that you think it's planned and we jump on it, we might be able to help save your life. So really important for people to call 911. We still have people that pull up to the ER quite frequently with significant problems that probably should have called an ambulance, but they don't. And so we really want to push that in our community. Call an ambulance, because that might be the thing that saves your life.
Yeah.
Anyway, any other thoughts on that one, Crystal?
I don't know. You hit it pretty well.
Not bad.
I'm just here for moral support.
I appreciate that.
And I'm getting a little queasy. Maybe we should let's talk.
Are you okay?
All the blood
I'm
talk?
okay. Blood talk.
Blood talk.
Maybe we should take a quick break and
sounds good.
Come back in just a minute. And thanks a lot for tuning in, guys. We'll be right back in a few minutes. Good morning, Pagosa, Friday morning. And hang in there. We'll be right there. Okay.
Time for KWUF weather. Currently 36 degrees under clear skies. Humidity 55%. The wind is from the northeast at 2 miles per hour. The forecast for this morning, partly cloudy, temperature 43 degrees. This afternoon, cloud-filled skies with some breeze, 63 degrees. Then this evening, cloudy. We've got a chance of rain. Temperature 43 degrees. That's the weather on KWUF.
skiers and boarders, Wolf Creek Ski Area has excellent spring conditions. The Midway base depth is 65 inches and all lifts are operating from 8:30 to 4. Saturday the 29th, Wolf Creek will host a ski boot dance with live music from JJ and the Hooligans. Sunday is the 85th anniversary trivia hour. Local appreciation rates will be available March 31st through April 6th. Additional details and events at wolfcreekski.com. Ski this weekend at Wolf Creek. The Pagosa Springs Knights of Columbus cordially invite you to their 29th annual Lenten Fish Fry this and every Friday night through April 11th. The Knights will be serving both dine-in and drive-through from 4 p.m. to 6 p.m. at the John Paul II Church, 353 South Pagosa Boulevard. The menu will include 2 large fish fillets, a generous portion of French fries, coleslaw, and condiments. Net proceeds will benefit the Catholic Church and other charitable community projects. Please join the Knights for a slice of Pagosa Country hospitality and a great meal. Okay, we're back at the Pagosa Springs Medical Center, and we're speaking with Jason Webb, the EMS Chief and Director of EMS, and Crystal DeCola, the Director of Nursing. So, trauma, we're still on that topic. I feel a little better after the break, but, we'll
give you some
easy
crackers,
on the blood talk.
some water, yeah. Yeah, we will get off of the harder parts of it. But I wanted to kind of transition a little bit into, trauma. I was talking about how important time is, and we're working against that. And then, of course, as everybody in our community knows, we're getting ready to enter in, or we've entered into a big construction project downtown where they call it the CDOT project. And there's a lot of impacts of that, both good and bad. But how does it relate to trauma? And so I wanted to talk a little bit. I've had quite a few questions from community members about what are you guys doing as public safety resources related to this. So obviously the CDOT plan was, as we're moving through the downtown area with the ambulance, it's going to slow us down. It's going to make us less efficient getting places. And quite frankly, I think there's going to be some more pedestrian traffic, so a lot more congestion down there while all that is happening, and that can definitely impact our golden hour. But right. The EMS team, a few weeks ago, we were able to meet with the construction team and the CDOT group, and along with the other public safety entities, and we started working on a plan of how we're going to be able to do the best we can while this project is going on. From an EMS perspective, the first thing that we kind of put out there is you're going to see an ambulance now on the east side of town that's going to be posting over there. So on the other side of the construction project. And really what we did is we split up, my Deputy Chief Connie Cook and I, we split up the service area, which is huge, 1,800 square miles, yes, into 2 kind of districts, and putting that ambulance on the other side. So we'll have the ambulance on the east side and we'll have an ambulance on the west side. And so with those posted in those places, we'll be able to respond quicker to where we need to get to. So that was step one. The other,
is that at the fire station there?
On that side over there, yes. They might not be right at the fire station. The crews might be parked just about anywhere over there. Usually in the summer, you try to find some shade when you're posting.
Right, there's not much shade right there. That's
no, so we'll probably try to find some trees and some places to make it not so hot. But we'll be over there so that we can respond quickly. As a matter of fact, just today, we had an incident down Highway 84 down by Echo Lake, and we were down there lickety-split.
Car in a lake or something?
Yep, car in a lake, and so we were able to get down there within 4 or 5 minutes after the call came in, versus if we were coming from uptown, driving all the way through town, add another 15, 20 minutes of drive time. So right there, we've saved 20 minutes of our golden hour if that person really needed something. And so I think right now we've already seen that our methods are starting to look like they're going in the right direction with this. We've also worked very hard under Sheriff LaRue, Chief Rockensock, and Chief Bertram. We all worked together to have a communication plan with the construction crews, so they know when we're coming. When we're coming through town, we're able to communicate with them before we take off and let them know we're coming. They can slow down traffic in different ways and open up lanes for us so that we can get to where we need to go. And so we really feel like that'll be our best shot at being quick and efficient, especially if it's something that's downtown. But as this project continues, we'll all learn about it, and we'll all learn the best ways to go. We'll use some of the back routes to get around town, and we'll keep working at the goal. Again, is the golden hour. We really want to be fast at what we do, and we want to make sure that we can get to people and get them back to the medical center, to Crystal's team, so that people can survive these incidences that they're involved in.
Yeah, I guess, is it Crystal? Oh, no, wait, Crystal, no, it's Bristlecone or
Bristlecone?
Cascade. I don't know which road. That's another way to go around, I guess, but it's all dirt roads.
Yeah, if you head down South Pagosa down there.
It's one way to get to South Pagosa Boulevard, but
if you just go south on South Pagosa and turn left on one road, eventually you'll end up on Trujillo Road.
Right.
And then from there, start heading towards downtown. And I think a lot of people will use those back roads, so might be a good way to do it. Another one is Light Plant Road is also an important road. It might help you get to the downtown area a little bit quicker. So we'll be leaning on those roads as well, especially during peak season when school's letting in and out, and all those. The traffic's going to be elevated down there. So I think we got a good plan, and I've got a good team over at EMS. Our command team is really, really good, and they know these goals, and we'll keep working to make sure that it's the right thing for the community.
So, Crystal?
Yeah.
So what happens when they get here and they hit the door?
I think Jason covered that pretty well.
Yeah,
I think just with all of the services that we offer here, you have you get a nice set of a complement of very skilled individuals who are here looking out for your best interests from many different lenses, which is important. And it kind of brings us to the next topic we wanted to talk about, which is a little update on the medical center in general and some of our services. As many people likely know, we have the medical wellness building that's right on the edge of the campus here that we are really focusing on expanding our physical therapy program there. We brought on a physical therapy assistant I think she's been here about 6 weeks or so. And we actually have an occupational therapist who's going to be joining the team in April too. So really building out that team to serve our community. And like Jason said, if you are unlucky and suffer from some type of trauma and you need some physical therapy services, we'll have
That's
you
the
covered.
Renovated building. Yep. Is it open yet, or you're going to have an open house? I know at some point.
We are just waiting on some details from CMS and the state, and we should be there soon.
Nice.
I'm hoping those come sooner than later. Everybody's really excited. It's a beautiful space.
It looks great. You guys have really
looking forward to having an open house and bringing some people in to see the space. Let's see, what else do we have? Barry Holcomb, our pulmonologist, started. He has been very busy seeing patients in the clinic, and we have actually started doing pulmonary function testing here.
Yeah, that's good with the elevation and everything. It's a great addition.
It is a great service, and people don't have to drive all the way to Durango to have it now.
Exactly.
So we have our PFT machine here. We have specially trained respiratory therapists who run the pulmonary function testing. And so another I guess I would say added bonus to having not only the pulmonary function tests from Dr. Holcomb is you're getting respiratory therapists who they are respiratory therapists by trade. They have their license, and now they have just a little bit more training and education to be able to provide the pulmonary function test.
Yes.
So that's exciting. I think we've done about 15 of them, and we have many more scheduled, so they will be busy. Let's see. As far as other services, neurology, so we're adding more neurology coverage in our clinic. So that provider we'll start seeing patients here in a couple weeks, I think. And of course, I think we all know, we've talked a little bit about Dr. Webb and Dr. Steed, and our ortho service line continues to grow with the Mako robot and such. So people are, our ortho team is busy as always. I think they will always be busy. A great group of people. The surgeons are great. The support staff, MAs, nurses in the clinic and in the OR, they make a really great team. And then of course, like we've already talked about, they transition off to physical therapy. So it takes a village, and I think we've built a pretty incredible village here.
Yes. Oh, absolutely. It's amazing. Thank you so much. And, well, I think we got it covered, and I really appreciate you guys taking the time to join me here in the conference room at the hospital. And, I know you're busy, so we'll call it good. And, hope the trauma, hope there's not too much. And, that's a lot. 1,800, really?
If it is, we're here. We'll take care of it.
Okay. I think, you guys will. We got it going on here. That's excellent. Thank you so much, Jason.
Thanks, Will.
Crystal.
Thank you.
We'll see y'all later.
Time.
Yes, you bet. Thank you. All right. And everyone have a wonderful day. Great weekend. We'll see y'all later.